Interesting. How is technology impacting your field?
Yeah. So social media is a big thing as far as technology. I just gave a workshop on, leveraging social media for professionals. I think that has been a huge platform in education and using it properly to put out reliable information. It has changed the way I practice by having a platform to be able to educate patients. I think it's improved when I see patients who come in now to me. They are already somewhat informed about things because they follow me, on social media, so they know what I'm putting out. So I think that, for as far as technology is concerned, that's a big one. AI is emerging, in the healthcare industry. I don't know a whole lot about AI, but certainly something I want to kind of dive into because I know it's going to change the way we practice medicine. Robotics have already been in the field of medicine. You hear about robotics in other fields like general surgery or even OBGYN field where the surgeon is at a console operating, using handles and different instruments to do, which is the surgery on the patient. So the surgeon is not actually standing at the table with the patient for those who may not really know what robotic surgery is. But we're using robotics in the field of head and neck also. It's like amazing to do robotic surgery on a tumor in the back of the throat. Like it's like that is just huge, when you think, okay, yeah, somebody's belly, it's a bigger area, to be able to get to, but to be able to use a robot in the back of the throat and do it, it's absolutely amazing.
Yeah, that's fascinating. I'm wondering, as far as the environment goes, you know, in Chicago is a great example. All of the EPA violations are towards the south side. It factors in
Oh,
like
okay.
asthma rates are higher in those
Sure,
neighborhoods.
sure.
Are you seeing any trends when it comes to how environment might be affecting people's health as far as ENT goes?
Yeah, and I would say more from the respiratory standpoint as an ear, nose, and throat surgeon. Maybe I can't even remember if it was this year or last year, but do you remember the Canadian wildfires, right, that were coming over? In Ohio, which is where I am in the Midwest, we were feeling that impact, from the Canadian wildfires. You could see how it impacted the quality of air in our area. I mean, it was literally palpable, like you could literally see it, in the air. And I was getting a huge influx of patients who were coming in with increased respiratory problems, sinusitis, sore throats, even how it was affecting their eyes because of those wildfires. So absolutely. We had in my area a city that's close to me that had a train derailment, okay, in Ohio. And there was a lot of chemicals that were spilled. It was just the huge impact on that town and how it has now created a lot of respiratory problems. And even the way they tried to, I think, clean it up or deal with the crash was not good and catch actually literally putting it on fire trying to get rid of the problem, but that made it worse. But you see that, and then of course the impact of cigarette smoking and vaping and all of that, and how we need more regulations on that too. But I did see a study recently that looked at the rates of vaping in youth has actually gone down.
Hmm,
So I'm really happy about that, and I think a lot has to do with the regulations that they put on it.
interesting. Um, what are the last question? What are the biggest misconceptions about ENT that that patients usually come in with?
Hmm. That's a good question. Misconceptions. I think sometimes patients don't realize how diverse
Mm,
the field of ear, nose, and throat is because there is a lot of overlap with other specialties. For instance, plastic surgery, dermatology, oral surgery and dentistry, we have a lot of overlap when it comes to those fields. So we see a lot of conditions that someone might think, no, that's not ENT, or, that's, I don't want to see an ENT for that. I need to go see a dermatologist. Like, for instance, skin cancers. You automatically think, oh, I have to go to a dermatologist, when we in the field of ear, nose, and throat do a lot of skin cancers. We see a lot of patients who have dental issues that are causing sinusitis, so patients don't think about going to an ear, nose, and throat doctor. So I guess the misconception is just in the broad aspect of practice that we have. We really do touch on a lot of conditions in the head and neck. I say if it's the head, it's between the brain and the shoulders, come see ENT.